Welcome to this explainer. I'm really thrilled to have you here today. Usually, when we start talking about scientific or medical topics, we just jump straight into heavy textbook definitions. But today, we're going to skip that entirely. Instead, I want to start by building a bit of a mystery with you. Think about the invisible systems operating all around us, every single second of the day, just keeping our society functioning.
Really think about it. Why do some diseases completely disappear from our daily lives, while others just seem to rapidly spread across entire continents? It's not luck, and it's definitely not just random chance. There's actually a deeply calculated reason behind it.
And who's actually working behind the scenes to make sure the water flowing from your tap is safe to drink, or that your food is thoroughly inspected, and our roads are designed for safety? Who's actively monitoring the globe so that sudden outbreaks are stopped in their tracks, or making sure disaster plans are ready to go way before a crisis hits? We rarely see them, but they're always there.
So here's a somewhat provocative thought for you. What if I told you that the absolute greatest medical breakthroughs in human history often happen long before a patient ever sets foot inside a hospital? We're so conditioned to think of health purely in terms of doctors, stethoscopes, and emergency rooms. But true health, it starts much, much earlier.
The answer to all of those questions, this incredible invisible force acting as a shield over our entire society, is public health. It's the science that protects entire populations. And today, we're going to unpack exactly how it works.
Section 1. Medicine versus public health.
So to get a handle on this, we really need to draw a line between clinical medicine and public health. Medicine is all about treating the individual patient after they get sick, right? You break your arm, you go to a doctor, they fix it. But public health is about protecting and improving the health of entire populations through prevention. It's about making sure you don't fall and break your arm in the first place because your environment is safe. A really common pitfall, even among health professionals actually, is mistaking primary curative care, like a small local clinic, for true preventative public health. Obviously, treating diseases after the fact is crucial, but true public health strategies focus on preventing those diseases from ever happening at all.
Section 2. Defining the core mission.
Okay, so this is the classic academic definition from CEA Winslow, coined all the way back in 1920. He called it the science and art of preventing disease, prolonging life, and promoting health. Now, I know that sounds a bit like a textbook definition, but the underlying meaning here is actually a fascinating blueprint for our daily lives.
Now, what's really interesting about this slide is how Winslow expands his definition into actionable steps for society. He didn't just stop at preventing disease. He explicitly highlighted that this is achieved through organized community efforts and informed choices. So this isn't just about handing out medicine. It's about structuring our society, our organizations, and our communities to empower individuals to live healthier lives. It's a massive, collective effort.
And if we look at how the World Health Organization views it, they scale this concept up to a global utilitarian goal. They state that public health aims to provide maximum benefit for the largest number of people. It's an incredibly powerful mission statement. When resources are limited, public health asks, how can we do the most good for the most people right now?
I actually really love this one from the Institute of Medicine. They define it as fulfilling society's interest in assuring conditions in which people can be healthy. Notice the word conditions there. Public health is essentially about creating the right environment, whether that means clean air, safe roads, or equitable policies where health can just naturally thrive.
Of course, a huge part of creating those safe conditions involves keeping an eye out for threats. Public health professionals are constantly monitoring for an epidemic or an outbreak. Basically, this is defined as the occurrence of cases of an illness in a community or region that is clearly in excess of normal expectation. Spotting that excess early on is absolutely key to stopping a localized outbreak from snowballing into a global crisis.
Section 3. The engine of public health. So how does all this theory actually translate into action? Well, public health relies on massive disciplines. Think epidemiology, biostatistics, environmental health, all working together to execute three core functions. First up is assessment. This is where we systematically collect, analyze, and share information about healthy communities to figure out exactly what the problem is. Second is policy development. We take that scientific data and use it to make rules and policies that protect people. And third is assurance. We have to ensure that these vital services are actually provided and reach the people who desperately need them.
And this brilliantly illustrates exactly how those three core functions break down into everyday actions. The 10 essential public health services involve professionals from so many different backgrounds: health economics, behavioral sciences, occupational health, working together far beyond hospital walls. You can see how assessment involves monitoring health and investigating issues. Policy development is about informing the public, mobilizing partnerships, and writing policies. And assurance, that's about enforcing laws, linking people to care, assuring a competent workforce, and constantly evaluating effectiveness. With research sitting right there in the center, driving the whole shebang. This wheel is literally the operational engine that keeps our communities running safely day in and day out.
Section 4. A localized reality check. Public health in India.
Now let's ground this in reality. The Western world largely completed its major public health revolutions, like sanitation and clean water infrastructure, way before antibiotics were even introduced. But in developing nations today, they're fighting these historical public health battles right in the middle of the antibiotic era. Because advanced medicines exist, there's this massive tension where funding and focus get pulled toward curative services, which really dilutes those vital preventive efforts. To combat this, a country like India relies on a massive tiered structure of national, state, and local health systems. It's driven heavily by primary healthcare and absolutely incredible community health workers on the ground. But what the data tells us is that this structure needs to fuel a true people's movement, one that champions basic health conditions as fundamental human rights.
Let me give you a really clear example of these active threats. Oral rehydration solutions, or ORS, is a straightforward, brilliant public health concept to prevent deaths from diarrhea. The ingredients are easily available in almost every single household. It was designed to empower everyday people. But instead, the pharmaceutical industry saw a market, took over the concept to net huge profits, and essentially disempowered local populations from managing this basic health issue at home. It's a stark example of profit clashing directly with public health equity.
Furthermore, we so often fall into the trap of thinking medicine alone can solve everything. Don't get me wrong, vaccines are miracles. The total elimination of smallpox proves that for sure. But vaccines are not a magic panacea for all public health failures. The recent resurgence of polio in parts of India is hard proof of this. We literally cannot just vaccinate our way out of the problem. Eradicating a virus like polio fundamentally requires the provision of safe water and basic sanitation. Environmental health has to work hand in hand with medical intervention, especially as India's system evolves to handle not just infectious diseases, but a huge rising tide of non-communicable diseases too.
Section 5. The future of prevention.
The source material for this explainer leaves us with this incredibly powerful statement: the egalitarian dream for India and the developing world should not die. The time for public health action is now. Public health isn't just some background utility like electricity or the internet. It is an active, vital human right that requires constant vigilance, advocacy, and real action.
Public health is the invisible force that protects millions of lives every single day. And it does this not by treating illness after it occurs, but by fiercely working to prevent it before it ever begins. So, the next time you drink a glass of clean water, I want you to take a second and think about the incredible community efforts making that possible. Because if public health is the invisible shield keeping us all alive, the real question is, what happens to our society the moment that shield cracks?